About 5 minutes. All right. Hi, everybody. I wanted to say thank you very much for coming out on this rainy evening. And bear with us as we go through this presentation. I don't really have anything planned because I want to dedicate a lot of the time to the experts on the panel. And we are missing one person. I'll introduce him on a high level, but unfortunately, Mike is not here. He was the hydrogeologist and he's not feeling well. But I'm hoping that we can look at this today as a start. And my hope in doing this is that all of us have some level playing field and understanding. We'll get a lot of, as many questions as possible answered. And we are not going to address any litigation related questions. It's just not the forum to do that. If today goes well, which I'm sure that it will, the idea here is that we're going to take everything that we know and just be on common ground. And in working with the Environmental Commission and these folks, what we'll do is a more roundtable discussion with activism based on people's interest. And we'll talk a little bit more about that. So, but it's really important for us to be able to speak with each other and get questions answered about testing and PFAS levels. And some people don't know exactly what that is. So I hope that this is going to be beneficial. I am open to your feedback once this event is over, and we will adjust and address that. Again, today is a start, and I want to say thank you again to all of you and to the panel. So what I'm going to do is actually go through and introduce our panel members, and then address some guidelines for how today goes, and then we'll just jump right into it. So we've got Andy Mossy, who's the Executive Director of the Land Conservancy, and lots of Woodstockers know Andy. So Andy, thank you for being here. Andy has a deep passion for speaking up for public lands without a voice. Since the beginning of his career, he's worked with nonprofit organizations for the public the Catskill Center, and before that, the Leading Space for Outdoor Ethics. He holds a BS in Expeditionary Studies from Plattsburgh. So, Andy, thanks for being here. And next on our panel, we have Timothy Rose. Timothy has a Bachelor of Science degree in Environmental Engineering Technology from the Pennsylvania State University at Harrisburg, and a Master of Public Administration degree from Marist College. He's a New York State licensed professional engineer, a board certified environmental engineer with a specialty in water supply and wastewater, issued by the American Academy of Environmental Engineers and Scientists. And Tim is a professional, especially in environmental science and policy, issued by the Board for Global EHS Credentialing. He's got 16 years in the environmental health field, 10 years experience in the solid waste control, solid waste and recycling fields, and has experience in dam safety, erosion and sedimentation control, stormwater management, and flood control. He's currently the acting public health director and director of environmental health services at the Ulster County Department of Health. And Vincent Martello is the Director of Community Health Relations of the Ulster County Department of Health, and he's a manager of the department's Health Education Unit, HEU. HEU works closely with all sections of the Department of Health, the County Executive's Office, other county departments, and community partners to advance Ulster County's innovative and proactive wellness and disease prevention agenda. an agenda that is designed to improve lives and reduce public and private healthcare costs. HEU coordinates statistics and data on population health, manages the Department Community Health Improvement Plan, creates and distributes public health messages through traditional and new media platforms, hosts Ulster County's Chronic Disease Prevention Council, and participates in a broad spectrum of community health and mental health coalitions. Vince is a former Assistant Deputy County Executive, former supervisor of the town of Marbleton, and a highly experienced communications and policy professional. And we have Paige Bogart, who came in from the state. Paige is an environmental analyst serving the New York State Department of Health Metropolitan Region. Paige provides technical assistance to municipalities and helps develop community-specific source water protection plans through New York State's Drinking Water Source Protection Program. The acronym is DWSP2. Her work includes coordinating with stakeholder groups, guiding source water protection plan development, collecting and interpreting data, and developing source water maps for municipalities. She also helps communities identify source water protection actions and provides guidance on applicable funding sources. And unfortunately, Mike, who works very closely with Paige and with the rest of the folks on the panel, Mike Forging, he is a hydrogeologist and he couldn't be here due to just his personal stuff happens. Hopefully Mike can come down and visit us at some point in the future. And I should introduce myself. I think most of you know who I am. My name is Anila Cordes. I am a new town board member. I ran my election by saying that I wanted to help to start this type of dialogue. And again, I'm grateful for everyone for being here on their own time. So before we get started, you have index cards, you've got pencils. If you need anything, we've got Urena. Erin is somewhere over here. So we've got, and just raise your hand. Will get card and bring them up to Erin. And so, you know, when we say a town hall, there are many different styles of a town hall. Today, we're doing it this way so that we can answer as many questions as possible and not, we're going to try to consolidate questions. Like if we get 12 questions on the same topic, we're going to do our best to consolidate that and so these folks have to get approval from their bosses to come down here on their personal time and share this material. So we really do want to answer those questions as much as possible to get that baseline. But what I want to say is I'd like for us to take a minute here, you know, to remember the land that we stand on and we sit on, right? It's very important for us to think about the people who were here before us, the indigenous people of Woodstock and this area. So my ask of you tonight is to embrace the responsibility, act as a good neighbor to each other, and yes, let's be conscientious stewards of this land, which is located within the ancestral homelands of the Lenape-Munsee people. So I'm gonna ask you to just bear with me, close your eyes for 30 seconds, but don't just close your eyes and like wonder whose question is going to be first or what's going to come next. Please really embrace the people who were here before on this land and consider respect for each other, for our land, and for our water. So I will ask you to please just take 30 seconds to consider that. Thank you. So I'm going to turn this over to the first person who's going to speak without a slide. It's going to be Andy.
Everybody, I just wanted to offer just a quick note as we get started here. I'm very excited to share in this moment with you all and just have this opportunity to communicate with you. Can everyone hear me okay? Okay, great. So my name's Andy, for those of you who I haven't met, and for those who I have, very nice to see you all again. And I'm full disclosure, I'm not a water expert, so I'm very excited to hear from these folks here who have more of that experience and can share with us. The one note that I really wanted to offer here is, as Executive Director of the Woodstock Land Conservancy, we consider lands and conservation priorities within our community, as well as the surrounding communities of the Eastern Catskills region. So with all of this, water is one of our most precious natural resources. And as we open up this discussion today and hopefully answer some good questions, that is the perspective that I hope to offer here, is just how conservation can play a role in water protections and how conservation can help to increase water quality efforts across our region. Thanks.
Thanks very much, Andy. And Tim's going to be speaking next. Oh, Vincent,
That's okay.
Yeah.
See, Tim is trying to upstage me. Hi, everyone. Thank you so much, Supervisor McKenna and Noah, and all of you for having us here tonight. We really appreciate it. So just a little bit of background on me, and there's a reason why I'm doing this, is that I'm a former resident of Woodstock. In 1997, I bought a house on 28A in the town of Marbletown. And a couple of years back, I went to a meeting of local it's kind of a meet and greet kind of thing. And they almost immediately said to me, "We want to run you for supervisor. Don't worry, you don't have a chance in hell of winning anyway." There's no Democrat that been elected in the 300-year history of the town. So I did run, won by 22 votes, and I'm the happy camper. I'm taking office. And what's the very first issue and challenge I get confronted with? The entire High Falls aquifer is contaminated by the most serious carcinogenic volatile organic compound that was produced by a small machine shop sitting on top of Mohawk Mountain Road, pouring degreasing solvents into the drains, and contaminated the entire aquifer. The only reason we found out about it was because a resident had gotten a full battery of tests, not just the bacteriological, but the full test, and they found it. And thank God, for Maurice Hinchy, because he really worked with us to help us, get Superfund designation. But, it was really a crisis. It was really a community crisis. Years previous that I had lived in High Falls and drank that water. So you can imagine that the community was pretty concerned and not knowing where to turn for help. But we eventually, we came together as a community to confront it because we really had to. We were literally all in it together. If when a community loses its water for any reason, it's, it can be game over. But we really came together as a community. And thank God for Maurice Hinchy, and we finally got, we got the EPA involved. We tried carbon filters; those didn't work. We got $22 million filtration plant. We hooked into the New York City aqueduct. But the reason, and the reason I'm telling you this is for a couple of reasons. One is it was the worst case scenario pollution you can imagine, almost as bad as Love Canal water-wise. But we came together as a community and we resolved it. So, this situation here is, it concerns you, recognize that. However, on a scale of 1 to 10, with 10 being the worst, High Falls was at a 12. This is somewhere in the 1 range, or maybe, whatever number you want to use. The second thing is I want you to understand the concept of point source pollution. Point source pollution is when pollution is obviously coming from one source, and once it's identified, it can be stopped, turned off at the source, and mitigated. And In the 1970s, when the Clean Water Act was signed along with Clean Air and the rest of them, the federal government really went after point source polluters, major industrial polluters like factories that were, had waste pipes going into the Hudson River. If you could shut down those big industrial polluters, you would eliminate a great deal of pollution that you have to worry about. Another great example of point source pollution is Stewart Airport, where the Montreal National Guard used firefighting foam for decades, and those PFAS chemicals made it into the water systems. So just hang on to that notion of point source pollution, because it's going to come up in just a few slides. Great. So what are PFAS? PFAS is an umbrella designation for over 16,000 different chemical compounds. They were first manufactured in the 1940s, and because of their widespread persistence in the environment, they're found in every ecosystem in the world. They found traces on Mount Everest, in the Marianas Trench, in the Pacific, in every ecosystem, in all animal species, human beings, and so on. Can you go? So where are they found? They're found in all of these things: food wrappers, coated paper packaging, waterproof clothing, cosmetics and sunscreens, personal care products, shampoos, pesticides, all of these different things that make them ubiquitous and persistent in the environment. Switch it to the next one. So, because they're everywhere and they can come from anywhere, we pretty much all have a responsibility to reduce the risk, meaning your public water supply and every resident that has a well and a septic system in a town like Woodstock, because Woodstock is a hybrid between a public water system and wells, right? So on the public water supply side of the equation, the public water supply has to do regular mandated testing. And in this case, Woodstock goes above and beyond that testing by doing quarterly testing for PFAS. It can, if it finds anything, it can introduce carbon activated filtration that will get those chemicals out. And it can also protect the areas, and does protect the areas surrounding, if it's a well that's providing the water in the public supply, then it can protect the area around the wellhead, right? If it's a reservoir, like the Ashokan Reservoir, that's a larger protection area because there's a watershed of tributaries and streams that feed into that surface water. So the city spends a lot of time and energy and effort in protecting that public water supply. But on the property owner side, like in Woodstock, where we have hundreds of wells, maybe over 1,000 wells, and septic systems, and all of those different products that we all use every day where PFAS are found, we all have a responsibility to our family, ourselves, our families, our neighbors, and our community to do our part to make sure that we pay attention and that we're mindful of what is going down our drains into our septic systems and into our groundwater supplies, right? So when we talk about point source pollution coming from one place, PFAS can come from as many different places as there are wells and septic systems in the community. So we really need to be paying attention about what we put down our drains, what we put on the ground, what we put in the ground, in and around the property, because it can all eventually find its way into our water systems. So I'm going to show you, so next slide, please. If you want to be, Tim will go through the PFAS level testing, and you'll see that it's really lower than, certainly lower than the New York State threshold of 10 parts per trillion, and even lower than the 4 parts per trillion, which is the EPA threshold, which is analogous to about 4 drops in 20 Olympic-sized swimming pools. Is an analogy that there is. But if you want to be 100%, really, if careful and err on the side of caution, there are very simple countertop carbon activated filters that are readily available. That one on the left is made by Culligan. It's available on Amazon for $35. The other one is from Freshwater Systems, $99. And if you want to do some research, you can search the Environmental Working Group's 2024 Guide to Water Countertop Water Filters, ewg.org. But if you go to that site, ewg.org, you can also search all kinds of products, personal care products, everything that I showed in that second slide, from clothing to home furnishings to personal care products, and choose those products that are free from PFAS and a lot of other harmful chemicals. That's the proactive part that all of you play in helping to keep our groundwater supplies clean. And can you go to the next one? So that's just a screenshot, but you can see that there are all the different categories: cleaning products, personal care, baby and diapers, mattresses, all the other products that we use that can contain all manner of chemicals that are harmful, that we really don't want in our water or anywhere else. Next slide. So I'm going to then now turn it over to Tim, but just know that we are very much on this. We are 110% behind you. I've lived this as a resident who drank contaminated water, as a supervisor who presided over the worst case scenario instance of water pollution. But coming together as a community, and each doing our part and recognizing our role and responsibility to be part of the solution by working together is really the way to do this. So thank you.
Thanks.
Thank you, Vince. Tough act to follow. A little bit about my background, just real quick. I know a little bit of bio. I was raised in Woodstock. Was born in 1967. Became my age now. But I grew up in Woodstock. From the time I was born right through high school, went on to going to Ulster Community College until I had left the nest, so to speak, and I went to Pennsylvania for school. So, and worked down there for a number of years before I eventually came back. I think it's great that there's such a turnout here tonight. I think it's fantastic. I wouldn't expect anything less than the residents of Woodstock. I know you very well, not personally, but I do know that the core values of this community. I think it's a great thing. Everyone showed up, especially with this number. So my role, again, I'm Director of Environmental Health Services for the County Health Department, and just in the interim, I'm acting Public Health Director since the Commissioner retired. The County Executive Act, I'm step in while they do a national search to fill that role. I'm sitting in that role just temporarily. Over the next month or two, they should have a full-time commissioner in, and I can go back to environmental health full-time. So when I speak tonight, I want to talk a little bit about the monitoring, the levels that are out there. And I'm speaking as a regulator, and it's something you have to understand too. The regulations are written in Albany. They're primarily adopted out in Washington, D.C., but they're also tweaked in Albany. They tend to become a little more conservative at that level. Our job at the local health department is to enforce those regulations. So we have couple hundred public water supplies. If you count all the restaurants, which are also considered public water supplies that are on our own wells, we have several hundreds, which is public water supplies that we regulate. In total, environmental health, we regulate about 3,000 facilities in this county. So that's, that's your hotels, your motels, your restaurants, your public water supplies. So fortunately, I got a great staff. Very well tuned to what's going on, and they do a great job. They have great people in the water program, so they have a handle on this. They're watching the sampling as it comes into the office. They're tracking the sampling and make sure the water systems are doing what they're supposed to be doing. So, the monitoring under the rules requirement, all public water supplies have to now monitor for PFAS. There's initial monitoring, and as they go through this initial monitoring, I don't want to really get down into the weeds because it really gets detailed. These water regulations, by the way, are a couple hundred pages long. Feel free to look them up online if you like. All you do is Google New York State Department of Health or NYSDOH Part 5 water regs, and they'll come up. But I think they're 250 or 300 pages long, something like that. So if you want to read something tonight, it's great. But in short, the way it works is that all public water supplies, and when I say public water supplies, I promised myself I wasn't going to get down in the weeds too much tonight because I know time is limited. But you have to understand, public water supplies are broken into 3 categories. This is important for you to understand. There's community, there's non-transit non-community, and there's transit non-community. So let's start with the transit non-community. Think of the word transit, right? It's a transient population. So that's your deli. That's your restaurant, where someone's coming into the restaurant or the deli, they're grabbing a cup of coffee or they're not. That's the lowest level of regulation that's required. There's really not much monitoring needs to be done. There has to be disinfection, some bacteriological monitoring, and so forth. Okay. The theory is there's a big difference between chronic exposure and acute exposure, right? So if there's a carcinogen that's in the water supplies, it's like this: if you smoke 1 cigarette, you're gonna get lung cancer. Probably not. If you smoke cigarettes for 20 years, you're gonna get lung cancer. The likelihood increases drastically, right? So when you talk about chronic exposure, you're talking over time. Acute is something like E. coli. If E. coli is in water, you drink 1 glass of water, and you could really get sick from that. And depending if you're being compromised, you could be fatal. So that's the lowest level. The non-transient non-community, real quick. Think of it as a factory where employees are going there. They're working there for the day. They're exposed to the water, so to speak, for 8 hours a day or something in that range. And then they go home and they're at home and they're living in the food system. So that's the middle of the river. The highest level is the community, and that's what Woodstock is. All right, there's people living on the system. They're cooking with it, they're bathing in it, and so forth. So we're talking about, so when I talk about the regulations, I'm talking about from the community standpoint. So if you Google those regulations I was just talking about, I want to make sure it's clear that you have to really delve into some of the weeds. You got to figure out, is this a community supply, non-transit? What are they talking about in regs? Or when the sampling has to be done. So for the PFAS, quarterly sampling is initial. They'll do a couple of quarters. If things are coming back okay, and I'm not going to get into the weeds on this. I'm just going to try to stay in a general manner. If the results are coming back okay, if they're non-detect, then eventually the water system can move to annual. And then they can continue doing annual testing of the water supply of the source water. And if everything goes well over a couple of years, they can ask for authorization from us if they can go to every 3 years. Okay. So it's important, something Vince was talking about with 4 parts per trillion. That's 4 drops in 20 Olympic-sized swimming pools. I want you to keep that in mind for the levels that they're testing down to. These levels are so minute when you're talking about a part per trillion. Again, 4 drops, 20 Olympic-sized swimming pools. A lot of the equipment is really hard to try to find to detect levels at that threshold. All right, and so a lot of times what happens, the lab will come back and they'll give us an estimate. Well, we think it's around 2.9. We think it's around 3.2. That's our best guess because the equipment can't test much more than that. So we had an instance where we had some hits of PFAS in a water supply, and I really didn't think it was a real hit. I really thought it was either a lab error or it was a sampling error or something. We went back, we tested, we had a hit again, and we were trying to figure out this just doesn't seem right. There's something that is just not making sense to me as an engineer, you know, and as a scientist, it doesn't make sense to me. So I asked my staff, when you conduct the sample next time, do it outside the building. They came back fine. Come to find out they had sprayed foam spray in the building. They'd done some insulation work that we weren't aware of. And just by opening the bottle, it was contaminated like that. It was airborne. It wasn't coming from the water supply. I went to one conference a number of years ago, when this was first breaking, and they talked about you have to wear a cotton shirt, it has to be washed 6 times, this is the fabric soap that has to be washed, and they had a list. Because as soon as you open that bottle, it's contaminated. I've done petroleum sampling in my career. They used to tell us, make sure your gas tank is filled up the day before. Because if you fill up your gas tank in the morning, and you sample in the afternoon, the fumes are still on your hands. And you're gonna get a hit of petroleum. And that was testing a parts per billion, not a part per trillion. So that was 1,000 times less. So these sampling errors come up. We see these at the health department. So sometimes if we get a hit of something, I'm not overly concerned yet, unless it's at, that off the charts. Thinking it could be a sampling error, we're not really sure where this is coming from, let's try to confirm it. So, maximum contaminant levels, MCLs, and I'm just gonna say what, I'm just gonna talk about MCLs from here on out. If you're so inclined to look at the regulations, you're gonna see MCLs all over the place, depending on what you're looking for. Because some of these things that are in the regulations, some of these parameters, may be aesthetic. Iron, for instance, okay, iron is more of an aesthetic issue than it is a health concern. The clothes may come out a little, I know when they do flushing, they probably notify you when they do the flushing of the hydrants in Woodstock, and that stirs up the iron, right? So if you don't do your whites, but yeah, certain levels of iron are good for you. Everybody needs iron, some sort of iron intake. So maximum contaminant level. Could you go to the next slide, please? All right, I talked about compliance. I'm getting ahead of myself. I talked about quarterly. Why is it right here? I'm sorry. We talked about quarterly monthly. You can go to annual if the results come back okay. What I mean by okay, that means either non-tax or if they're below the MCL, and if they're and as long as they're reliable, below the MCL, then we can continue moving forward with the annual testing, and eventually you can go to triannual if you need to. Next. Again, PFAS monitoring on a quarterly basis. I was really happy to learn when I spoke with Anula and with Bill that the town wants to continue doing quarterly, which under the regulations they could go to annual. If they asked us, we could allow them to go to annual. I was very happy to hear that they're going to continue moving quarterly until they try to figure out maybe what is this which well is just going to come to work.
Folks, really, thank you.
So I was very happy to hear the town is going to continue doing it because the sample is it's not cheap, I'll tell you that. So but it's a good thing to hear they're going over and above what we would require under the regulations. And I keep stressing the regulations too, because it's important for you to understand that if a town or towns are always usually in compliance, and if it's not, it might be costing you $2.99. Some of the private water systems, sometimes we get a little trouble with some of the private water systems. And you have to understand that if push comes to shove, they're not doing what they need to do. I need to go before I need to be in consultation with our attorney and go before a hearing officer to present a case. And I need to point to some sort of regulations that they're in violation of. So you have to understand that there is some legal authority that we have, and I need to point to something. I can't make things up. That's just not going to fly. The guys in the hearing officer, so or our attorney for that. Next. All right, PFAS levels. One thing I do want to talk about right off the bat before I forget is many of you are probably aware. You see that 2.39, that last sample that came in. That was originally posted as 0. When I got the results, I was like, oh, great, it came in as 0, it was non-detect. The lab then notified us and the town at a later date. I don't have the dates when they were notified, but we were notified at a later date that the lab felt that there was an error. So they went back and retested some of the material they had. They said, oh, we did know that it was a hit, we call it, and it's around 2.39. And again, these are estimating what they're because you're at such a low level at part per trillion, they're trying to estimate exactly what it is. So, and again, prior to that was 3.8. You'll see down in the lower right-hand corner, the levels are, the MCLs are 10 right now in New York. There's a lot of, I want to mention that too, because I know there's been some confusion with the town. And what's the difference between the 4 and the 10, and why are we enforcing the 10 and not 4 and so forth, so. The EPA in April lowered the threshold for parts per trillion. New York State is still at 10, they still have to go through the rulemaking process, that's gonna take some time to go through that. So the enforceable limit for us, it was just required that they provide treatment for something along those lines, is 10. That's a legal issue at the state of New York. Again, we don't write the regulations at the local level, this all comes out of Albany. So I did check just recently within the past week with Albany where that is. They said we're still in the process, Tim. 10 is the enforceable limit in the state of New York. So now, with that being said, if the town decided that they want to provide treatment on the water system, that's fine. They're going over and above what we would require. We're not going to require, but the town wants to do it. That's completely up to them. What is required is that if the town does decide to go down that path, that those plans, once they hire a consultant to design that treatment system, those plans would have to come to us for review and approval. We would have to go through the engineering analysis to make sure that A, it's going to work, B, that there's no additional threat to the public health it's being designed for whatever reason that may be. So our engineers on our end review those designs to make sure that everything's going to work and everybody's going to be safe and happy. So that does have to come to us if they ever chose to go down that route. Next. Okay. I almost took this out, this starts to get into the weeds, but if the results of a monitoring sample analysis exceed the MCL, then you have to collect 1 to 3 more samples. Again, no MCL was exceeded here, so the town didn't need to do that. It was not required. But if that result come back at 11, or one of those results came back at 11, then that would trigger this. All right, so they would have had to gone back and sampled 1 to 3 more sample locations. And typically what will happen is that the municipality, the water operator typically are in contact with us all the time and say, how many do we need? Where do you want to take them from? And so forth. We'll come up with an agreement where they're going to put the additional sample. So that usually runs by us. An MCL violation occurs when at least one of the confirming samples is positive, and the average of the initial samples and all confirming samples exceed the MCL. So you got to do some quick math to try to figure out if there is actually a violation, because just because you're over 10 doesn't mean there's a violation right away. So you got to follow up with this. Again, it's 10 parts per trillion for New York State and working with EPA. Next. All right, here's the tier. This I want to put in here too, because I understand that there were some issues with the residents not being notified by the town and so forth. I heard some whispers of that. So I want you to understand. There's tier 1, tier 2, and tier 3 notifications. So when you go back and read the regulations, and I'm sure you all will. Great reading, great reading. My wife thinks I'm crazy. I'm just gonna tell you something real quick. I was on my honeymoon in the Czech Republic. My wife was sleeping on the bus as we're going through the countryside. And I woke her up. I said, honey, you're not gonna believe it. She said, what? I said, look, there's a wastewater plant. And she I'm sorry, I didn't think that. But I love talking water, and I think it all night if you're willing to listen to it. So tier 1, tier 2, and tier 3 notifications. All right, so tier 1, what is that? Now, tier 1, that's the highest threshold, right? That's if there's a public health hazard. You think of E. coli, I always think of E. coli, right? So you don't want to if you drink 1 glass of water with E. coli, you could really get hurt, right? So the water suppliers have 24 hours to notify somebody if they don't normally wait 24 hours. That's just in their regulations. If something serious happens in the water system, they're on the radio, they're notifying them, they're putting it on the website, they're getting it out there as fast and quickly as possible. And we make sure that they're following this, by the way. So, if you look over to the right, the media outlets, such as television, radio, and newspapers are used. I mean, I don't know about newspapers anymore, but the website, I always like the website. That's a great way to do it. For social media, Facebook, anything along those lines, just get the word out, okay? Tier 2 is where the PFAS falls, all right? That's not an imminent public health hazard. It will be over time, if the levels are up high enough, you continue to drink that water, right? That's what studies have shown. That you have to be notified, if there's an MCL violation, again, you have to go back and do your repeat sampling and do your quick calculation, say, okay, there is a violation here. Then they have 30 days to notify the public. So there was no MCL violation here, so under the regulation, the town wasn't required to notify the public. And I just want everyone to understand that there was no violation. Should they have notified the public, that's up to you to decide. I'm speaking as a regulator, so understand that. All right, so that's the tier 2 notification. Tier 3 is if there's something extremely minor that happened in compliance, they were out of compliance for some reason. I think they even have an example here. Oh, failure to make the required water sample on time. If there were 2 days off or 3 days off and they didn't hit the quarter right or something like that, then they actually had 1 year to notify the residents. And that all these things you'll normally see on the annual water quality report. Are you guys familiar with that? It has to be posted. It's usually posted on the town website if you're not familiar with it. But if you're on a water system, that's a federal rule. That has to happen. So they used to call it the Consumer Confidence Report, the CCR. They changed the name on it several years ago. But it's called the Annual Water Quality Report. That's a report that all public water systems have to issue to the residents. And typically they always post it on the website. I think pretty much everyone does that now for everyone to see. And anytime that they're out of compliance and so forth. So next. Mitigation. All right. Should it happen where it does work in the MCL, the town is required to put on treatment, or if the town decides to do it on their own, that's up to them. These are the two primary technologies that are used for removing PFAS. They call GAC, granular activated carbon, and membrane separation, typically reverse osmosis, not so much nanofiltration. You won't normally see that. But even the reverse osmosis on a system this size is probably not going to happen. In the system this size, you'll probably see the GAC. That's really what the engineering firm most likely proposed. And again, the high pressure membranes of the reverse osmosis and the nanofiltration. Next. Granular activated carbon. It not only removes PFAS, granular activated carbon is a lot in the water treatment field, and also what they call PAC, which is powdered activated carbon. Both of those things are used a lot. Real quick, if anybody remembers their chemistry and so forth, there's a difference between adsorption and absorption. Okay. It really works on adsorption, so it actually it'll bond with the carbon. The PFAS will bond with the carbon, so eventually that media has to be replaced. All right. Sometimes you can backwash it depending on what type of contaminants you're taking out. There is a positive impact on corrosion of lead. I don't think there's an issue with corrosion control in Woodstock that I can recall. I don't know if there's anybody that knows anything about the corrosion. You don't have corrosion control here. I don't think you do. I wouldn't know that. It removes 100% of contaminants over a given period of time. And when that media is taken up, when all that adsorption happens, not absorption, but adsorption, D, as in David, when that happens, you normally have to replace that media. So, and oh, by the way, those small tabletop units that Vince was talking about earlier in Vince's presentation, that's what a lot of those are. So they do a lot of that scan. It's actually really good stuff. Next. Oh, I guess I'm done. Okay. I'll talk more.
Always more.
If I talk white, I want to talk sewage. Actually, real quick before I lose the floor. Something Vince said earlier, which is really important. All right, you are all. I shouldn't say all. If you're on your own septic system, okay, you all have a responsibility of what's going into the ground, because for those of you that don't know how they work, as you flush the toilet and things are removed from the house, it goes out to a septic tank. And that septic tank is only going to hold the solids. Right? And this is my little PSA, the public service announcement real quick before I leave. That tank should be pumped out about every 3 to 5 years. There's a lot of people who don't do that. So that tank should be pumped out by a certified honey wagon and take it to a wastewater treatment plant to have it properly treated. So the reason I mention this to you is because when you flush things down the toilet, and whether it's doing your laundry and cosmetics and all sorts of things, remember, even cleaning agents. A lot of those they're not going to stay in the septic tank. They're going to really primarily pass through and go out to your leach field. That leaches in the ground. Now, if it's designed correctly, that will be treated before it hits any groundwater. But there's a lot of old homes in Woodstock. I know the house I grew up in was built in 1962. And I can tell you that septic system was probably on rock, which wouldn't be allowed in today's world. And when it was built right on bedrock, there's a lot of rock in Woodstock. It doesn't allow for the treatment. You've got to have a soil layer to allow for some sort of treatment. I know there's study being done on PFAS moving through soils. I'm not an expert in that. Don't know a lot about it. It's a lot of new tech, a lot of research that's being done. I do want to find out more about it. How quickly it does go through. But you do have a responsibility. If you're on the town wastewater system, it can still pass through it up in Saltwood Creek. If you know where the wastewater plant is down on 212, it eventually ends up being discharged between Big Deep and Little Deep. That's what the discharge point is. And it could eventually end up in the creek. Because a lot of these things, like pharmaceuticals, pharmaceuticals get washed right through the wastewater plant and into the receiving waters. I just want to piggyback on what Ben said, and you all do have a responsibility. So just be careful what you're putting down the drain. It's all an accident. So, well, I think I need the time.
Can you hear me okay? Okay. I know I introduced me already, but my name is Paige Bogart. I'm an environmental analyst working for the Water Source Protection Program, also known as UWSP2 out of the New York State Department of Health. So we work with municipalities to help develop and implement UWSP2 plans, and we're currently working with the town of Woodstock. Me and my colleague Mike, who unfortunately couldn't be here today. So we just want to give you a broad overview of our program and then talk a little bit about the work that we're doing with Woodstock and some steps we're taking to help protect your drinking water. So you can go to the next slide. So our program focuses around source water, and when we talk about source water, we're talking about where your drinking water is coming from. And I know most of you know that is coming from groundwater. So pulling water from an aquifer, and then that water gets treated and then distributed out to consumers. So our program focuses on everything that happens before it gets to the treatment plant. The next slide. So it's important to protect source water because we really want to reduce the risk of contamination. And Tim and Vince have already talked a little bit about where that comes from, but contaminants can come from many different places, such as landfills, agriculture, transportation, road salt runoff, also, many different residential areas, such as the leaking septic tank, and just reinforcing what they've already said, where you put down your drain is very important. It could also come from fertilizer use or a leaking oil tank. So it's important to be proactive, and I think that's what's really great about our program. Instead of installing a bunch of treatment in a water treatment plant, we really want to prevent the contamination from happening in the first place. And there's many different ways that we can do this. Some of the more common ways are listed on the slide, such as conserving land. This can be through the outright purchase of a land or a conservation easement. It could be through incorporating source water protection into your local zoning, educating the community, what we're doing right now, and then also restoring buffers. And if you're unfamiliar with this, it's essentially when we plant certain types of vegetation around your drinking water source, it acts as this natural filter. So in terms of developing a DWSP2 plan, I won't get into too much detail here, but I just want to give you an idea of the process that we're going through with Woodstock and some of the steps that we're taking. So the first part of this program is assess. So we'll start by looking at water quality and availability, we'll look at past sampling results and history of MCL violations. This is a very broad water system overview. We're also working with local officials and community members in your town to identify any current water quality issues that might be having that we can incorporate into this plan. The next step is looking at potential contaminant sources. I mentioned some earlier, but some others can include, bulk storage tanks, mines, remediation sites. So, we will inventory all these contaminant sources and provide detail on each one. And then the last step here is completing source water maps. So we'll map out land use, land cover. We'll also draw a boundary around your source water where you can focus your protection efforts. So once we're done with that assessment stage, we move on to strategize. So taking what we learned, we will come up with different protection and management methods to help protect your source water. I identified some earlier, such as conserving land, but this can also include, maybe implementing road salt best management practices, and there's many more. And that brings us to our last stage, which is protect. So, we recognize that a plan is only good if we implement it. So we don't just create a plan and then let it sit on a shelf. We will really work with your community to make sure that this plan gets implemented and help find funding and support the initiative. Go to the next slide. So that brings us to Woodstock. So we are very early on in the plan development. We started working with your community a couple of months ago. So we're kind of wrapping up that assessment stage. We're going to strategize. So just keep that in mind when I go through some of the priorities. This is not all encompassing. There's many topics that we're still talking about, and we're still very early on in those conversations, so that's why they're not listed. But just to kind of go through these, some things that we'll be doing is creating a groundwater model to help protect your municipal wells. We will be identifying those potential contaminant sources, detailing them and mapping them out. We'll also be evaluating water quantities, so ensuring that your current water supply covers your current needs, and then also planning for the future. And then the last thing here is PFAS, and I'll go into more detail on the next slide. So we will be considering this as a priority issue, as more of like a cautionary, as those levels are low, and what Tim already explained. So yeah, we agree with the town's decision to continue monitoring more frequently, and then we'll also be coming up with different protection and management methods to prevent this contamination in the future. So that's really the focus of our program, is preventing contamination. And yeah, that's about all that I had. I'm sorry for like the lack of detail. It's just we're so early on in the planning stage that we're just not there yet, but in the future we'll have a more detailed presentation to really go over everything. So yeah, it's about from there.
Thank you very much.
So we've got that. Thank you to everybody on this panel. Really, that was amazing. So we've got this resource page. This will be on YouTube. And I'll post a link out on Facebook and help spread the word and get it out there for folks, just so that it's easy to see the data and to put the links and start looking at what you're using, like make wiser purchase decisions, right? Again, we all depend on each other. So we're going into the Q&A session next, but before we do, I actually just want to do the thank yous. So everything, I wanted to say thanks very much to Melanie, right? So for being here again, late, long day, thanks for recording this. So those folks who couldn't make it today actually get to see this, and people who are here can reference this. Thank you very much to Erin Moran, who helped to just organize all of this. A to Z, and was a sounding board. Thanks very much to Supervisor McKenna. Not sure if he's still here, but thank you. So Bill helped ease the way with some of the introductions to folks, and also from the Land Conservancy, I want to say thanks to Kevin. He's not here, but there you are. All right, there you are. So Kevin and I have spoken I don't know how many times and for how many hours about water, before I took office. It's just happens to be a passion and, likewise. So thank you for hearing this idea out for many months. I appreciate it. And, we have, Terry, thank you very much, and Janine, and I'm probably forgetting someone. That's why I want to do thank yous now, so if I forget anybody, I can say thank you later. Real fast on next steps, and then we're gonna dig into the Q&A. So next steps, again, if you're interested in knowing more and being more involved, just please reach out. The idea here is that we're gonna get into working sessions, and that's where, you know, if you feel this passion and you really care about this, we need you, right? I mean, because it's all of us together. And as you hear, we have a chance to actually make our town, like, to preemptively avoid a catastrophe. This is gonna be a topic that we're all gonna be talking about from here on out, across this country and beyond. So just, you know, please feel free, I'm accessible, and we want to get groups together who are interested in different aspects of this. So with that, we will go into the Q&A. And I'll read the questions, and we have no set format for who answers the question. So I will do my best through this process, bear with me. And the first question is there special training needed for sampling?
Yes, there is. The sampling being done at the water plants are traditionally done, or typically done by the water operators themselves. Although it doesn't have to be, some water plants do contract out with a lab, have the lab come and do the sampling, but either way, it's in our eyes, in the health department's eyes, either way is fine. The water plant operators are licensed, they have to go through a training program, they have to pass numerous exams. And then believe it or not, they also have to come to us for the vetting as well. So once they conduct the proper training time, proper coursework and so forth, we have to do a walkthrough before we sign off on them becoming certified licensed operators. And we'll walk through the plan to make sure they understand the plan. We ask a lot of questions, and if we don't feel comfortable, then we will not sign off on that individual getting their certification. If we feel comfortable to sign off, it'll go to the state health department to have the district license. So yes, they are well trained, the water plant operators. And if the municipality or even private water systems, a lot of private water systems will contract out directly with the lab will send an individual out, conduct the sampling. These people are well versed. They do it all day long. So yeah.
Okay. This question is, the EPA does say that an appropriate maximum contaminant level is 0, despite an enforceable MCL of 4 parts per trillion. Although New York State is not required to adhere to this fully until 2029. Sorry, just bear with me as I read many different types of handwriting here. Okay, so there's legislation proposed for New York State offers a 2 to 7 part per trillion limit. If approved, how would this affect have the town address? I'm sorry, I'm just really struggling with this. I'm gonna give this to Tim. Just repeat that.
I got last.
Andy, can you?
Here, let's give this a shot.
We'll have Andy give it a
If
shot.
approved, how would this affect how the town addresses the issue given the latest test results?
There's a lot going on in that question. I don't think I can answer that. And the reason is because I don't know if they're going to keep with the same guidelines. If you look at one of the earlier slides I had, you know, there's a calculation if you're over the MCLs exceed, you have to go back to 1 to 2 sampling. There's a lot of depends or buts involved with these regulations, and it also depends on the type of water system it is. We're talking specifically about Woodstock. I don't know if those parameters are going to change. I don't know that. So that would be very speculative for me to say. Because a lot of times when they change an MCL, they'll also change maybe the sampling protocol. They'll change where the sample has to take it from, what time of year. Like for instance, trialmethanes and trialmethanes and alicylic acids. Those have to be done in July and August, right? So further, as this PFAS movement moves and more research is being done, it's very possible they may say, you know what we found, that these limits are elevated during certain times of the year. Could be when it's very warm, could be when it's cold. So for me to speculate on what would happen, whether or not the town would be in compliance, I wouldn't want to go out on that limb because there's a lot of different factors that play into that. So, you know, I'm just being honest with you, because there's a lot of new research coming out every day. Just saw something 3 days ago that they're finding PFAS down polar bears. And I know a couple of weeks ago, I saw that they're finding in dairy now. So a lot of this it's emerging. So, rather than speculate, because it could take a right angle.
And this question is for Vince. Please describe how High Falls citizens got together and resolved the water issue there. Woodstock can learn from that process.
Sure. First of all, we had many information sessions where we brought in experts like hydrogeologists, Environmental Protection Agency scientists, Army Corps of Engineer people. Our feeling on the town board and me as supervisor was that if people don't get the facts from the source, accurate, timely facts as we know them, and in a crisis, those facts develop as you learn more about what's really going on. If people don't get the facts from the source, then they tend to make up multiple versions of the facts. So we endeavored to be as transparent and open as possible, and encouraging people not to speculate, you know, if they had questions to come to the sessions that we had with the experts to ask the people that are really in the know. This was a really frightening situation. A lot of people were really freaked out about this because if we didn't have the New York City aqueduct running through town, and we didn't have Maurice Hinchey helping us turn this into a Superfund site where the EPA built us a $22 million filtration system, we might have had to shut the ambit down. That's how bad it was. Yeah. But we came together, you know, and you know, we just had to have each other's backs and really be patient and be as freaked out as we were. We knew that we had to work the problem, you know, honestly, openly, and with, you know, a lot of understanding of the fear and what was going on, and be really supportive of each other and bring in, you know, the help. And you know, we had some of the best and brightest people in the country working with us on this problem, and eventually we got past it. But it took us a while, you know, and so, you know, when I say, you know, this Woodstock is in many respects is way ahead of the curve. You know, if I had known if I knew now what I knew then, and I were a supervisor of a town like Woodstock, I'd be doing many of the same things that we're doing here, and what this meeting is all about, is proactively engaging the community, providing information, providing resources, and enlisting each and every citizen to be literally ambassadors of clean water, because that's really what it does.
So there's a question, can someone on the panel answer? And I'm not sure if anybody can, but I'm going to ask the question, what Woodstock's emergency backup municipal water supply sources mandated by New York State DEC is?
I can answer that. Or do you, Jay, you want to answer that?
Sure.
So one of the plans that the town has is we do have access to Cooper Lake water. The 2-foot water main comes right down through town. And if you look on the, when you're going westbound on the right-hand side, you'll actually see a standpipe that comes out of the pipe. We have the right to hook up there. We have a plan where we would bring in a temporary water district, because that water is surface water, it's not been treated, it gets treated down in Xena. And but we would set up a temporary filter, which would be housed in the town hall. The water would then be dumped back into the pipe right outside the town hall. We have a connection there, and that's our emergency backup. And I can tell you, when the issue of PFAS came up, the first 2 calls I got were from, I'm spacing on his name now, but the existing head of the Kingston Water Department. The second call I got the next day was from the former head, Judy Hanson, offering help and guidance. So we're all in this together.
Thank you. The next question, what can you tell us about home testing resources for possible PFAS compounds?
Home testing, and I assume this is for people that own their own wells. I'm not aware of any home tests because you have to be very, very careful when you take these samples. There could be something airborne in your house. Who knows, that could cross contaminate the bottle as soon as you open it. If these tests are not cheap, a full part, what we call a full part 5 analysis, which includes this. It's a complete scan that we require any new public water supply, even a restaurant. I mean, if a restaurant's building a new building with a brand new well and so forth, somewhere on 212 or whatever the case may be, we require a full part 5 analysis to be conducted. And those, depending what lab you go to, those samples are about $45,000 each. That includes about $4,000 to $5,000 each for each sample. That includes more than there's just the PFAS. That's a scan of a lot of other things that we require. Any new public water supply. We don't require for individual homeowners. We build a home, you drill a bunch of hole in the ground, drill your well, it's your responsibility to test whatever you want. So there's no health department requirement. I mean, you're allowed to drink whatever you want. But if you're going to start serving public, serve water to the public like a restaurant, you do have to do this analysis off of that. And again, as with those 3 tiers that are there, as you work your way up, you have to do more and more testing annually, quarterly, and monthly, and so. But so as far as a home test is concerned, I'm not aware of any home test. You could, if you want to spend the money, you can contact a lab. There's 2 or 3 labs in Ulster County that does this type of work, and they will send somebody out. I would highly suggest you not doing the test yourself. There are some tests that you pull up a lab. We get these questions a lot at the health department. What should I test for? And we have a standard sheet that we give people, new homeowners, that these are the probably most likely things you want to test for. Unless you're next door to a gas station, you want to test for petroleum. If you have a newborn in the house, you want to test for nitrates. You want to make sure that you test for that because of nothing you know yet. Well, you could do a full part 5 if you wanted to, and that would include the PFAS. Again, it's $4,000 to $5,000 or so. If you break it out, probably just do it. Well, I was gonna say probably do the test yourself, but the problem is if you're not familiar with how to do the testing protocol, you might be throwing your money away because if you get against cross contamination. So if you're going to do that, my recommendation is call several labs. Just don't call one. You want to get prices, right? So call several labs. If you have somebody come out of my home, that's what PFAS. That'll include their travel time and so forth, and testing, take that one. And again, there's stuff, if you Google water testing labs in Ulster County, you'll see it. And we have it on our website as well.
And it makes it more cost effective just to have a water filtration system at home, even a countertop system, something that Vince was showing earlier. They're in some cases inexpensive and they go up from there, but they can be quite effective just to make sure. So if you're concerned about your drinking water, that's a nice, easy way to ensure the water that you are personally consuming is well treated.
I mean, I have a 500-foot well at my house, it's right on 28A, it's surrounded by city watershed property. At 500 feet, it's probably pretty pure to begin with, but I put a $200 reverse osmosis under the counter system in, I installed it myself. The water coming out of that tap is pretty much pure.
Did you speak louder?
I was gonna say, even though it's, I live I have a 500-foot well and I live surrounded by city watershed property. I put a $200 reverse osmosis system under the counter. I installed it myself. The water coming out of that tap is pure H2O essentially, but it was only $200. And these countertop systems are carbon activated filtration, are smaller versions of what a public water supply would put on its system if it were to find contaminants. So for $99, you could get a really good countertop system. Again, go to environmentalworkinggroup.org, EWG.org, and they rate all the filters. And they also have a list of all of the products that contain PFAS or any other harmful chemicals, so you can pick and choose about what you buy and use every day to, reduce the pollutants. And also that includes putting pesticides on your lawns, by the way. Roundup, right, is glyphosate, a carcinogenic chemical. And there have been class action lawsuits proving that it causes cancer. And yet I'm watching the Olympics a couple of weeks back, and there's a commercial for Roundup in the middle of the Olympics. So, EWG.org will help you be a safer consumer.
How complex a process is source detection?
Pretty complicated. Like Vin said, PFAS comes from everywhere in our food packaging and, even our makeup and the chemicals we clean our floors with. So, finding a source of PFAS is a really difficult process, but what's great about Woodstock is you're taking that proactive approach and you're very committed to finding a source. So there's people working on it. See what we can find out.
There's a follow-up point source question. If point source pollution allows a community to remediate an issue more easily, isn't it critical for Woodstock to identify the point source?
The thing about PFAS is that the point source could be in 1,000 places. Wherever there's a well in a septic system, the PFAS can be entering with groundwater. But with respect to the public water supply, it's basically wells and wellheads. And so the town, I think, had pretty much just created a buffer around those wellheads to as much as possible reduce the risk of anything coming into those systems. But honestly, for every well and every septic system in this town, that's a potential source of PFAS. That's why I say, pay attention to the things that you buy and consume and pour down the drains, because it can literally come from everywhere. Over 16,000 different chemical compounds in the consumer products that we buy and use every day. So.
Where in Woodstock is the testing occurring? This is a multi-part question. Are there multiple sites? Are those locations consistent over time? And does the testing include residents on wells?
I'm not sure who asked it. Is this specific to PFAS? If it's testing in general, I can tell you all over the town. And there's certain parameters you're looking for at the source. You want to test specifically at the source. There's some parameters you want to look at entry point. Entry point is defined at after treatment but before the first user. There are certain parameters like disinfection byproducts that are those compounds are formed over time. So you don't want to do that at the entry point, because you're gonna get a very, very low number. You want to look at the worst case scenario after a water tank. Let's say, because the form of water tanks is the water ages, so to speak. So those samples you want to take at a furnace point in the distribution system, look for the worst case scenario. So, and those are carcinogens, those disinfection byproducts, that's when you combine chlorine with humic fulvic acids. You don't normally have it in groundwater, which is good news for you guys. You typically get that much more from surface water. So, because of the organics that's involved. So in general, it's all over. It just depends on what you're looking for. And that, again, that's all prescribed in regulation and engineering methodologies and where you can test for these things. And does the testing include residence wells? No. If you're on your own well, you're on your own. And the fortunate thing, if anybody here is on the municipal system right now, and I know that PFAS is a really high issue right now, and rightfully so. But the good news is for the people that are on the system is that your water is being monitored constantly. I'm on my own well. No one's monitoring my water. Unless I do it myself. So for the people that are on your own water, it's really your responsibility. And I'm not aware of any grant funding out there that would allow for any type of grants we had as far as water sampling. It's one of those things that's part of being a homeowner. The only time that I've seen sampling being done is if there's a spill in particular. Let's say a tanker truck spill near a community, and there's individual homeowners, and those wells will be sampled. And that, by the way, is not DOH. That's done by PDC as part of their spill program. And if there is a detect, then they'll come to us, my program, and say, well, what do you think? Do we need to put treatment on these people's homes? And we say yes, or not. Whatever the case may be, we review the result, look at the methodologies and so forth, and look at it in public health standpoints. So there's really nothing out there for individual homeowners.
Okay, we have a question that, the question is, could this be tied to 10 Church Road? And it's a question that we're not going to answer today for a variety of reasons, not because we're dismissing that, but that's going to be a separate conversation that I think will be very constructive in moving things forward separately.
When?
I don't have a date at this time.
Is the panel aware of the Church Road?
Yes. The next question, at what level of PFAS?
That was an easy question to ask, Pam.
The person who would be able to answer that is not here. At what level of PFAS contamination should the town's public water system have filtration and GAC installed?
As I said earlier, the MCL is 10. So once that 10 is exceeded, again, they go back into the repeat sampling, like in one slide we had shown, and then we average those numbers together and so forth, and that's what triggers when treatment needs to be installed.
If the town ever went to every third year, triennial water testing, are they still required to post an annual water quality report?
Yes, all public water supplies, actually, nationally, that's actually a federal rule, not New York State, have to provide the public with annual water quality reports.
With
And
no
again,
test,
what's that?
with no test. How can you give a report? with no test?
Well, an annual required report, and I would suggest, if you're not sure what that means, go to the EPA website, they have a whole page, they have a lot of content on there with those annual water quality reports. So just Google it, and it'll tell you exactly what they have to report. To the best of my knowledge, all the community water supplies in this county posted to their website, which is the fastest and easiest way to do it, but that has to be done once a year.
There have been water issues with carcinogenic substances in several New York towns / cities, such as Hoosick Falls, Newburgh. How has federal and New York State government agencies learn to improve the speed and understanding for their response? Yeah, so there have been several water issues with carcinogenic substances in water, probably what we were talking about earlier. Maybe in Newburgh, around the airport. And I think the question is, how has the county, state, and federal government learned to improve the speed and understanding of responding to a crisis?
Well, fortunately, since Hoosick Falls, and I am familiar with Hoosick Falls, and Newburgh, by the way. Fortunately, we haven't been put in that position, since I've been back in the health department. I've been back because I worked for the state health department, with the county a number of years ago. I went off with some other things in my career, but I've been back 4 years now. And since I've been back, we haven't had a mission crisis. So that would be difficult to really answer. Without having gone through that, if I understand the answer, if I understand the question. Can I just say something? Sure.
In Newburgh, it really came down to a question of who pays, right? Because the Defense Department was responsible for creating that contamination in the first place, because it was the Air National Guard that had caused it. And so, you know, the representatives, state and federal representatives for years going after the Defense Department saying, you gotta pay to do this cleanup, you gotta pay to do this cleanup. I mean, they were pumping and treating like they did in Niagara Falls, but that takes a really long time. That takes decades to get contamination out. It's really a question of who pays, and, you know, the Defense Department was just really dragging its feet for a long time, and just recently it's beginning to come around to saying, yeah, we were responsible, but that's where advocacy and really, you know, hounding your representatives comes into play. You know, where that, especially down in Newburgh, that it really took concerted effort by citizens, by representatives, local and state level and federal level, to really, you know, hold the federal government, hold the Defense Department accountable.
Vince, you might have answered the follow-up. What is the anticipated timeframe to resolve the issue? So I know you mentioned it's a long time. Has that improved over time here in New York? Like a response to a crisis, or still money?
I don't know. I just don't, you know, I don't have the not the expertise, but I'm not involved in it, so I don't really, I couldn't provide a really honest answer for that, but you know, advocacy matters.
Thank you. Another question, in this community, can the wellheads with PFAS AS / PFAS OS be isolated and shut down while testing continues?
Sure, that is a possibility. The one thing you want to be cognizant of is the yield of these wells, to make sure you don't put a high yield one out of service. I don't have that data before me. All I can tell you is the answer to that question is that is a possibility. Normally I'm reviewing the data on the wells, the yields, and so forth, because there are within the regulations, when your highest well yield is, when your highest yield field is down or a well is down, you have to make sure you have enough quantity to still supply the community. And it's not only for health reasons, you know, as far as water to drink and so forth, but you know, fire flow and things like that. So you have to be concerned with the fire department. So there's a lot of factors there, but that, in short, it's possible.
Okay, next question. Wouldn't it be best protocol to have an independent analytical lab conduct the entire EPA 537.1 or 533 protocol, including collection of PFAS samples along with analysis?
That's up to the town. As the regulator, I can tell you that the New York State regulations is what I'm enforcing. And again, those regulations, if you want to look them up, they're look, just Google NYS DOH Part 5 water regulations, and they'll come up. That's what I enforce. That's what my charge is. As far as conducting additional sampling, that's not something we would require. But it's up to the town. They can conduct whatever sampling they like.
How do we ensure full, open, and public disclosure of testing results from all sources of the town water supply?
Well, again, when you look at those tier, that slide I had up here earlier, with tier 1, tier 2, and tier 3 notifications, those are MCLs are exceeded. That's one way that triggers that, and the other way is annual water quality report, and that's published every year, and posted on the town's website that you can look at. So, and that's a federal, again, that's a federal requirement.
And I think, remember, asked that question, so a communication plan that's specific to Woodstock would be part of a roundtable discussion, right? So what do we want here? There's what's regulated, but we want to do something that's more proactive, more transparent and faster. So, again, please consider just reaching out and let's get that going. What studies explain the danger of cancer occurring from everything we're talking about? And then follow-up questions, how many people got cancer from PFAS, AS/OS exposure? And what were the levels detected?
I think you'd have to do a full epidemiological study for for a specific area. There's a lot of research out there, but that's a level of epidemiological research that is pretty intense. It's done on a maybe it's done on a state level or done on a federal. I'm not sure. I haven't delved into the research myself, but I'm sure that there have been case studies done. You just have to look them up.
Why doesn't the wellhead protection zone include the upper Saw Hill sub-aquifer that drains into the well field? I'm not sure if anyone on the panel can answer that, or anyone in the room. And if not, then I'll set this aside and.
One quick answer, not directly in relation to that, but something that Woodstock Land Conservancy is doing. We have a strategic conservation plan and some critical areas throughout the town, as well as our entire surface area of the Eastern Catskills. We identify critical natural resources as important areas to protect, essentially. The headwaters to the Saw Hill Creek, as well as other creeks in our town, are identified within that plan as well to protect. And to date, we've had some acquisitions and conservation easements along those locations to protect them from further development. So, in fact, just this past year, within the past 6 months, we closed on another conservation easement, 35 acres or so, in the source water for the Saw Hill Creek. So excellent work there in terms of protecting our source water.
I think, if I understand the proposal correctly, I think the individual may be referring to what's called GWIDI. GWIDI, and in our water world, we call it GWIDI. It's the groundwater under the direct influence of surface water, is really what it comes down to. 20 years ago or so, the regulations that were passed that, depending on the geology of the wellhead was within 100 feet of the stream, 200 feet of the stream, and there's a lot of, again, there's a lot of ifs and buts when it comes into this. So if they were within these guidelines and they had to be tested for what's called GWIDI. GWIDI means if there's a creek nearby, is that water that's drawing out of the well, is that part of the creek water? So is there a direct tie, is an influence between those two? I think that might be what the GWIDI question is about. If it is, those wells were under a GWIDI analysis and they came back as negative. Had they come back positive, that there was interference, they could have done a couple of different things. They could have either just stopped using the wells, or they could have continued using them, but then they would have to provide additional treatment. And that treatment is quite intense, because when you talk about surface water, that puts you on a whole nother level than groundwater. So the city of Kingston, where they draw out, as you know, at Cooper Lake, and there's several others in Ulster County that draw out the Hudson River. That have to treat for surface water, and that would have put Woodstock in a whole different position as far as treatment's concerned. So, so I can tell you by knowing that it's verified. There was the good analysis came back.
Sampling protocols for PFAS compounds are very stringent and exacting. What are the necessary qualifications for personnel that pull PFAS samples in a public water supply system?
I think I answered that earlier, but the water plant operators can take the samples and they're well qualified. Again, they have to go through a lot of coursework, as well as experience working in the program and so forth. And the municipality does have the option of hiring a lab. And I can assure you that those people that come in from the lab, those individuals are highly trained, and they do it all day long, so.
Okay. If the entire upper Sawkill subaquifer becomes contaminated, wouldn't that affect all the private wells along the upper Sawkill Valley from Shady to Bearsville?
That's very difficult. There's a lot of things that could be introduced, and I'm not that familiar with it, so. That's something that a hydrogeologist could do. That would be a full-blown study that would take probably a couple of years to do. So, one thing I just want to back up on too, and I want to make it very clear, as far as the sampling question and who's qualified and who's not. When I say a lab within Ulster County, if anybody goes out and does want to retain the services of a lab, make sure that it's E-Lab certified. That's a rigorous testing protocol that's conducted by the state health department. Make sure that certain labs are conducting the analysis the way they're supposed to be conducting, and they don't get that certification without New York State giving them their blessing. So anytime any water operator takes a sample and takes it to a lab, or they retain the services of the lab, the first thing that my staff looks at when they come in is to make sure those results come from E-Lab certified labs. So I just want to be clear.
I'll answer this one. Can we have a future town hall event on the topic of landfill, leaching? And again, I'm sorry, just reading the handwriting there. Leaching, okay, thank you. Municipal water treatment facilities and PFAS OS/AS, including the pending release of a new draft regulation by New York State DEC. Yes, absolutely. What good is
Individual well testing.
Thank you. Okay, what good is individual well testing when they are all in the same aquifer?
I'm not sure where that question is going, other than to tell you that, again, if you're a homeowner responsible for your own, water supply, you don't know if it's in the.
No, I was talking about the town well.
Oh, the town wells?
Yeah.
Oh, I thought it said individual wells.
That's what we.
I thought individual water supplies.
Yeah, no, the individual town wells.
Got it. What was it? What was it?
Well, the question reads, what good is individual well testing when they are all in the same aquifer? So I think it's not individual like me as an individual, it's the,
Each source.
yeah.
We prefer, individual well testing, that's the way we want to do it. If there's PFAS coming in, and again, a lot of these wells are not in the same aquifer, they may not, one may be 200 feet deep, the other might be 300, they're all 20 feet deep here. Also, 20 feet deep. They're all 20 feet, and they're all, they've been confirmed to be on the old aquifer. I think that's taking, that's not, That's not an approach I would take. I would be much more conservative. I think that's taking too liberal an approach. I wouldn't trust those results. I mean, it's not that I wouldn't trust them. If you do them individually, you can isolate where this may be coming from. So if you just say, well, if I just test that at one well because they're all in the same aquifer, there are wells that are closer in area maybe to a potential source of contamination, right? So you may be excluding some wells that may have some PFAS in it, and you're only testing for the well that's maybe further away. So I think doing it individually may actually help.
I just want to add that in High Falls, the EPA came in and put in hundreds of testing. So all over High Falls to determine, and they found different levels of that contamination, throughout the community because, because of the way that underground geology works different than surface geology, and how the water flows through spaces and distributes and how soluble the chemical is and those kinds of things. So having those multiple locations, they were able to really keep a much more precise eye on what was going on and determination of what was going on. So really don't.
Well, can I just address that with a second?
Yeah, please.
So there are two well fields in the town that go their water level. One well field has 2 wells in it, the other has 5. And the well with 5, which is close to the Sortville stream, continually has tested fine. It's the well fields next to the wall field that has had issue tests. So the next step, actually we took tests today, I believe, the samples today, and we isolated the 2 pumps so that we have to test with each one to get a sense if it's that general area or a smaller area. So when people talk about source testing, I guess in a sense that's what we're trying to narrow it down if possible. So that's what we're doing.
And if I could just piggyback on that too, and Bill, one of those wells is brand new,
Correct.
right? So when that is done, that's going to speak volumes because because we've never had PFAS before, right? So if that is isolated to that new well, and I'm speculating, so I'm going to please bear with me on this. This is speculation. If it's coming out of that new well, it's very possible that the well pump that was installed, maybe there was some glue that they used that's causing these hits to happen. Could be some tape, who knows? Maybe some construction material that's in there that may be where it's coming from. It may not be coming from any source. That's a very real possibility. And if it does come back from that brand new well, that's something that's really should be looked at. So.
Okay. Are there state guidelines available for public water system operators to conduct groundwater contaminant source investigations, and what qualifications are needed?
Guidelines available for public water system operators to conduct groundwater. Oh, okay. Well, no. Public water system operators are not trained in hydrogeology and so forth to do these. That's typically a hydrogeologist that do that in conjunction with engineers. But water plant operators are trained to operate the plant, to respond to emergencies, to respond to water main breaks and that sort of thing, to do sampling, to do basic analysis, water chemistry analysis, how to tweak, let's say, if you've got sodium hydroxide, you're adding your system, how you're tweaking the sodium hydroxide. They teach about safety components and so forth. They're not in groundwater investigations. That's just not something the water plant operator does. Any water plant operator. It's typically that's typically a hydrogeologist that does that. That's the field.
Okay. Does the county provide funding to identify contaminant sources?
There's no funding at the county level. The, there may be some funding at the federal level, that the municipality can look into, it's very, very possible. Or at the state level, and I would think, opinion off the top of my head, there's nothing at the county level. There's just not, the resources just aren't there, so. But that's something they look at, probably at the federal level, the best way to look.
Last year, the New York State DEC issued final water quality guidance values to regulate PFOA, PFOS, and 1,4-D in New York State waters. The final human health guidance value for PFAS is 2.7 parts per trillion. Doesn't this suggest the town should act on the reported levels in our water supply that already exceed this value?
That's up to the town. That's not, as a regulator, I can tell you what the regulations say, and what we enforce. I have to hold myself to that standard. Again, because if the water supply, I'm not talking about Woodstock in general, I'm just talking about any water supply in the county, doesn't follow the regulations, I need to go before a hearing officer and the attorneys. And they're gonna ask me to point in the regulations where they're in violation, so the town is not in violation, so, but again, it's up to the town, if they want to be more conservative, they can. We would, of course, we would object to that. We would need to, if they want to provide treatment, we would need to review the plan and approve them. That would be a mandatory, but as far as requiring treatment, it's not something we could do.
Okay, what recommendations would the experts make to the town board on how to proceed? And this might go to the future planning, but that's a question for the panel.
I mean, you know, I obviously, I'm not in the Woodstock government, but what I've been able to glean from my conversations, meetings, and what's going on, it seems like there's a lot of awareness and work being done to prevent and mitigate, and really, you know, this meeting right here is an example of it. You know, it's never gonna be a perfect scenario, right? I mean, there are PFAS, as that chart showed, was for 16,000 chemicals found in every ecosystem in the world. Even if we were in northern Canada, in the Arctic, we would still find PFAS in our environment. But I think it's never going to be perfect, but the town appears to me, from a non-expert position, to be doing a lot of things proactively to stay on top of this and to, you know, prevention, and I think that's a really good thing. I mean, when I encountered that situation almost, I knew zero about water, anything. They're not, and the town hadn't done much about it. We learned the hard way, and it was a steep vertical line learning curve. But what you all are doing by way of testing more frequently than is required, what you're doing with the study that Paige is doing, what you're talking about doing, what you're working together on is really, really, to me, is exactly the right approach. It's not the perfect approach, because it's a learning process, right? We learn more and we get better, and that's what's really, really matters.
Yeah, just to add to that really quickly, compared to a lot of other communities, Woodstock, you know, is doing a lot. Just to speak on my program, you know, you're worried about PFAS right now, and that's the topic, but you know, through our program, we're also helping prevent future contamination, and that takes a while, and it's a long process, but it'll be worthwhile.
And they need a little bit of help here. What is the rate of absorption of PFAS?
Terrible. I don't want to speak for the whole panel, but I don't think there's anybody here on this panel who's qualified to answer that. That's a medical question. And we don't have any medical professional, but that's something you could ask them to provide.
Well, if the board is putting a lot about the water and then putting a filter in, but what about the water we bathe it? It's got PFAS in it.
Yeah, so like I said, we're not medical professionals, but there are contaminants that do absorb through the skin, so like PCBs, for example, and there's some that are just, if you drink it, it's a problem, but for PFAS, we don't know that at this time, but it's most likely on the EPA's website. So.
It most certainly works.
It's most likely on the EPA's website, they have a lot of information about that, so I'm sure that helps.
Okay,
I actually saw, I think it was on EPA, or I think it was on the EPA website that they cited that thermal absorption wasn't it wasn't a big problem, but then there are other articles that I read subsequent to that that said that maybe further research is showing that maybe it has more of an effect than people think. So again, you know, I would encourage, you know, there's more research coming out, I think, every day. But the original material I looked at and putting together this presentation, which was mostly from the EPA, seemed to indicate that thermal absorption wasn't really an issue, but you know, as more research is done, more is discovered. So no, I don't think we're not researchers in that area, so it would be disingenuous for us to speculate on what that is, but the research is being done and it's out there, so.
the New York State DOT continues to spray herbicides / Roundup along our roadsides and creeks. How is this allowed? These creeks flow into the reservoir in the Hudson.
That's actually DEC, that has nothing to do with the health department. The Department of Environmental Conservation regulates any type of pesticides and applications, so that's a question you'd have to listen
We do it on 28A along the Shilkin Reservoir, and it makes me crazy. Honestly. You know, I've written letters myself and said, you know, how could we be, you know, this is a critical watershed, how could we do that, you know, but I didn't get much of a reply, but you know, that's something that they'll stay on.
Okay, lots of good questions, and we don't have much time. I'm gonna ask this one. Can you describe the process of groundwater contaminant source determination for a shallow aquifer like Woodstock's?
Yeah, sorry, just to reiterate, we're not hydrogeologists and contaminant flow is a really complicated process, so. Yeah, it's hard for us to speak on that, so I'm sorry.
And we've got 4 or 5 minutes left, so what I want to do is just give everybody a chance to just say a few words and be very mindful and respectful of time at this time. So.
So as I had said earlier on, from our perspective, especially at the Land Conservancy, this is certainly a local issue, and it's really great to see this type of forum take place. Education is critical on this issue, but many others, and prevention is also quite critical. So at the Land Conservancy, we're doing as much as possible to identify key areas that are important to protect, and also looking for further support to be able to actively protect those areas. And then in addition to that, we're happy to be a part of a conversation such as this. So thank you, Nuala, and to the town for making this available to everybody. And as more topics of conversation come up and we can provide as much insight from our perspective into these types of conversations, we'd love to continue being a part of them. So it's for that.
And I would like to thank Nuala as well, and Bill too, for touching base with us and asking if we could come out and speak, because as you know, here tonight. I'm very passionate about water and very passionate about drinking water and so forth. It's just something I've really enjoyed doing, and I think it's great. I couldn't have picked a better career. I just really enjoy it, and coming out to these public forums, I think it's a great thing. And I think it's a great thing that the community's involved, because there are other communities within the county who are not. And it breaks my heart in a way. Not to sound any type of emotional or anything, but when people are engaged, especially about such an important issue of water, it's something that I thrive off of, and it's something that I find passionate and I'd love to talk about. And seeing all these folks coming out tonight, and because I know you've got families and so forth, would rather be home too, but to spend it here, listening to us, I think is a great thing. And it's a great thing that that you take such an interest in the supply, even if you're not on the community wars or not on the community system. And I imagine many of you are probably on your own wells, and you don't need to be here. And to see that those people could sit home tonight and say, well, it doesn't affect me because I'm on my own well. To have them come out and also voice people are interested in this, I think it speaks volumes. And like I said, when I first started this presentation tonight, I wouldn't expect any less Woodstock. I grew up in this community. I know what this community is about. And I think it's a good thing. So I want to thank you for coming in.
Yeah, just to reiterate what everyone else said, thank you Noah, for having us. It's been great being here. It is awesome to see like such an engaged community. I've had a great time working with Woodstock so far, even though we're still very early on in that plan development. But it's good to know that when we complete our plan and we come up with ways to protect your drinking water, it's good to know that we work for a community that will take that initiative to implement those projects. So that's about it.
I want to thank everyone, for your patience and for listening and sharing your thoughts. As bad as point source pollution is, as it was in High Falls, where you had one single source, it would have been great if we had discovered it sooner and shut it down sooner. The damage had already been done, but non-point source pollution, which since PFAS can come from anywhere and everywhere, it really literally is everyone's responsibility, as I said earlier. And the fact that this community is coming together the way it is, I think something you should all be very proud of. I think it's really great when citizens realize that that we're not leaving our lives up to the experts. We are the community. We are, we're not followers. We're all part of the leadership ecosystem that makes a community thrive.
Absolutely.
So I want to thank the panel for coming up. I thank all of you for coming out. I'm not going to claim to be the greatest communicator. I have shortcomings, and I'll admit to that one. But what I will say is, I just want you to know that from day one, and back in December when this came out, Tim and Vince have been my #1 source for information and guidance. So I hope you got a lot from them today. I'm not an expert, but I do rely on them heavily for guidance. So thank you guys. Thank you, Anula. Thank you, Melanie. And thank you, Evan.